Hi, I'm Dr. Sally Johnson. I'm a GP in Woking and I'm the clinical lead for the Surrey Heartlands Covid Vaccination programme. And I wanted to tell you a little bit today about how the vaccination programme is working across Surrey. The NHS is offering the vaccine to everybody that's eligible, and we're working with the Joint Committee of Vaccine and Immunisation, who've set the priority groups about who should get that vaccine first to make sure we're protecting the most vulnerable first. So when we started this programme, we offered the vaccine to all over 80s and to residents of care homes and to health and social care workers, people who are over the age of 70 and those who are in the shielded group, so those who are clinically extremely vulnerable. Over time, we'll be able to move on and offer the vaccine to slightly lower age groups, those in the 60s and 50s and other patients who might be at higher risk of infection. I can just reassure you that this is a huge programme and our staff are working around the clock to make sure the vaccine reaches those that need it. So please be patient with us. You will be contacted when your time is ready for the vaccine. Vaccines are being offered at a number of centres. We have 17 local vaccination services being run by partnerships of GP practices, and we have our large vaccination centre here at Epsom. We also have some community vaccinations being offered in pharmacies across Surrey. Our health and social care workers are also eligible to get the vaccine at some of our hospital hubs. When it's your turn, you might notice that you're called to a different general practice to your normal general practice, or even to other sites such as village halls and churches or even shopping centres. I think the really important thing to tell you here is that you will all be called for your vaccine. It's also really important that when you're offered a vaccine, please do attend the appointment, but also don't attend too early. It's really important we keep social distancing at our sites, and so we need to make sure that people come at their appointment time and don't arrive too early. There are a number of ways in which you might be invited in for your vaccination. Your GP practice might contact you via text, by phone or even by letter. And also, if you're going to be called to one of our larger sites, such as Epsom here, you might get a letter from NHS England. If you don't want to travel a particular distance to your site, maybe you're called to Epsom and that's a bit far for you, or you're just unable to attend because you're unwell, please don't worry. We will contact you again and offer you another appointment at another site. So again, if you just sit patiently, we will contact you if you haven't been able to attend that first offer. The other important thing to note is that all of the vaccinations on the NHS are offered for free. If anybody asks you for any kind of payment when you're booking an appointment, that is not part of the NHS service, and we would not ask you for any financial details. The first dose of vaccine will offer you good protection, but it doesn't give you full protection. So it's really important that after the first dose you continue to follow the social distancing measures that the government has recommended. Once you've had your second dose, which in most people will be at 12 weeks, that will give you a far greater level of protection. I think the message at the moment is clear, that even if you've had the vaccine, you still need to follow those safety measures. So that means washing your hands for 20 seconds, keeping your face covered when you're in close proximity to others, and maintaining that 2-metre social distancing.